Yeah. So as I had the previous paper on the incidence of myopia and prevalence of myopia, which is constantly increasing, and there have been multiple of articles which suggested that low outdoor activities and near work is one of the most important factors in progression of myopia. So this was a wonderful meta-analysis done and was published in BMC Ophthalmology 2020, where they suggested that one of the most important factors in progression of myopia is indeed low outdoor activities and near work. So with this background and with the lockdown that started in India due to COVID-19, which raised the number of hours the child would be inside, there would be imminent near work along with increased digital screen time and low outdoor activities. So there have been some studies which have suggested that there is a subsequent myopic shift in school going children after COVID confinement. We had around 36 children between the age of 6 to 12 years who were being followed up at our clinic and who were already diagnosed as myopes and were progressing. Despite we tried to convince them that they should be using some intervention for myopic progression, these were children who were not using any, they were not using any sort of therapy for myopia. And so these were ideal. I mean, we were not aware that there would be a lockdown in future. And so these were the children which became ideal children, where we had all the data of them pre-lockdown, and now they were home confined. And so we got a detailed ophthalmic evaluation done of them, as they were already, we were trying to tell them that they should undergo some myopia therapy, but they were not. So we did descriptive and inferential statistics which were performed data with, because this was a non-normal distribution, so instead of representing it with mean, we are representing it with median with first and third quartiles. And so this was our observations. The mean age of 36 children was around 8.7 years. The median progression in myopia per year, the median was 0.75 diopters, and post lockdown it was 1.25 diopters. Being a non-normal distribution, the median is being quoted. Similarly, for axial length, prior to lockdown, the median progression was around 0.24 millimeters, and post lockdown it was almost 0.63 millimeters in these 36 children. So there was a huge influx of axial progression, a direct correlation with near work, ocular strain, increase in indoor timings, and increase in axial myopia has been described by various co-workers. In fact, during lockdown, there was a wonderful letter to editor by Sumita et al. From Nayan Netralaya, where they suggested that there could be, they in fact predicted that there will be a spurt of progression in myopia. A similar increase was seen by Wang and their colleagues. The only problem in their study was the children which were seen were not the same set which were examined pre-lockdown. So there were different set of children. They just got the incidence pre-lockdown and post-lockdown, and suggested that the incidence of myopia has increased post-lockdown. Another wonderful article of Chang et al. Was published, where they did use the same set of population pre-lockdown and post-lockdown. However, they did not do a cycloplegic refraction and biometry. So it is very difficult to know that the near work can also cause accommodative spasm and a false sense of belief that the myopia is increasing. So you have to do a cycloplegic refraction all the children whom you are studying. So the strength of our study was that it was done on the same set of children who were assessed at multiple intervals without any loss to follow up. So we could show that it was indeed lockdown which was the important factor for the increase in myopia. Maybe imminent near work, maybe the loss of outdoor activities, but definitely quarantine was one of the risk factors for that. Few limitations of our study were that it was retrospective in nature, and we would have been happy to have a larger sample size, but at this point lockdown was unpredictable and unplanned, and we believe that these children can be followed up further and reassessed again to see whether now, once the lockdown is over, whether that makes a difference or not. So our study shows that myopic progression was significant during the quarantine period, and therefore it calls for strategies to prevent this, not the quarantine but near work and outdoor activities, which should be up on other agendas like National Program for Blindness, which should make it a national myopia prevention program with the help of Orbis and Vision 2020. Most of us are associated here in community with them, so that it would be a good call to incorporate this also into the program for blindness. Thank you so much, and thank you for your time.